Imagine if your brain was reset. Imagine not knowing who you are, where you are, or how you got there. Scary, right? The worst neurological condition is known as epilepsy. It's one of the oldest illnesses that can be traced so far back. It has always been one of the most common diseases from since Julius Caesar was alive until today, and probably will always be something most people suffer from. Epilepsy is referred to experiencing repeatedly epileptic seizures. A seizure is a brain's response to a disturbing stimulus. As it reacts, it releases an abnormal electrochemical in the cerebral nerve cells. Although one epileptic fit does not mean a person has epilepsy. A person must have repeated uncontrolled seizures, making it a chronic illness. As I talk to you about epilepsy, I'll be hitting the main points of the types of seizures, the cause of different epilepsies, and the treatments for them. Epileptic seizures can look different to anyone and everyone. There is hardly any function of the brain which cannot also be part of an epileptic seizure. As a result, seizures can manifest themselves in many different ways, in movements such as jerking, trembling, stiffening of the muscles. In sensory disturbances, it's going to be like tingling, numbness, hearing, or like seeing something. In so-called vegetative signs, flushing, the lips turning blue, your salivation and bowel sounds, and you're wetting yourself. Or in psychological changes, you have a sudden fear, or your sudden memory impairment, or loss of consciousness. One type of seizure is a partial seizure. This happens to be the most common that most people may experience. This type only affects one specific area of the brain. People may also become unconscious experiencing this. Another type is a generalized seizure, attacking both sides of the brain, but also attacking both sides of the body. Although it attacks both sides of the body, it is not to be mistaken for it to affect the whole body. A person will always become unconscious during a generalized seizure. A focal seizure is only affected by one side and a specific area of the body. Therefore, the same for the brain. A person is not to become unconscious to experience this. A person might experience a jerking of the head or going down in a bowel manner. There are many different causes of the various types of epilepsies. The most common is a residual epilepsy, meaning the epilepsies are in the past of a cerebral disorder. Such residual epilepsies can be traced back to an infection in the mother during pregnancy, to oxygen deficiency at birth, to encephalitis or meningitis in childhood, or to cerebral contusion or brain damage caused by a traffic accident. Process epilepsy is a type of epilepsy caused by a progressive cerebral disease, which is still active. The most significant and common cause of this type of epilepsy is a brain tumor, but can also be caused by disturbed blood circulation or metabolic diseases. Epilepsies are not passed down from family member. However, there may be several family members who experience epilepsy. This is because many diseases such as diabetes can be passed down, causing a predisposition. Any additional order, for example, complications during a pregnancy or at birth, a serious illness, or a head injury can trigger the onset of epilepsy. It is, however, not always possible to find the actual trigger of the disease. Such a type of epilepsy, which is mainly caused by genetic disposition, is known as a genetic epilepsy. In around one-third of all epilepsies, the cause of the disease remains unknown. It is clear, therefore, that anyone can get epilepsy at any time in their life. Today, there are very good methods available for treating epilepsy. Certain types of epilepsy are curable. Before beginning treatment, the patient has to be examined to ascertain whether the cause of the epilepsy can be removed. If this is the case, then a so-called casual therapy can be undertaken. For example, the removal of a brain tumor. In most cases, however, this is not possible, either because no cause for the disease can be found or because it cannot be removed. The treatment of these types of epilepsies is known as a symptomatic therapy. The symptomatic therapy used in over 90% of all cases of epilepsy is the administration of anti-epileptic drugs, which generally have to be taken over several years. Almost 60% of all patients who take these drugs become seizure-free, while the condition of a further 20% is considerably improved. In some cases, patients can be successfully treated using epilepsy surgery. However, this is only possible with focal epilepsies and can be only considered as an option in 5% of all patients. Epilepsy affects over 3 million Americans of all ages. This is a large portion considering not many know of this illness. Almost 500 new cases of epilepsy are diagnosed every day in the U.S. Epilepsy affects 50 million people worldwide. Many people experience a seizure daily but don't even notice it, simply because they think a seizure is always a person becoming unconscious. A seizure affects everyone differently and is something very serious. If a person in your family has epilepsy, you run a greater risk of developing it. However, infections and other diseases, and also the environment, can also become an influence on the risk of you having epilepsy.